Hello, and welcome to this month's installment of Picture of Health. Employees of Polk County interact with residents and the public on a daily basis, so it is imperative that they are in good health. At the annual Polk County Employee Health Fair, government staff members were able to get a free flu shot, learn about community health services, and connect with medical experts. Let's take a look.
Every year, the county offers an employee health fair for all county employees. This is their opportunity to come out and have their flu shots, which are free to county employees, as well as come out and ask questions of the vendors for health insurance vendors. We also have the local hospitals, some of our local clinics. They offer free vision, free hearing, some skin cancer screens. There is a bus out front. They do some mammography. Pretty much the community physicians will get together and they volunteer their time for this particular event. And they have little giveaways and whatnot for our employees. If the employees are getting their flu shot, we know, number one, they're not going to spread anything to somebody else if they come in when they're sick. Also, you're protecting the citizens of Polk County because we are in contact with the citizens of Polk County. Hopefully we're improving attendance by people, being well and not calling in sick and whatnot.
Thank you. You're welcome. Thank you for that mammogram. I will. Okay, good. Yes, ma'am.
I work for Dr. Plunkett's office. We are a local dentist office in South Lakeland. We are providers for the county's insurance. We are here, giving away toothbrushes, just promoting healthy body, healthy mouth, trying to get people to get in, use their insurance since they pay for it. Unfortunately, people don't really realize their coverage. Cleaning, exam, and x-rays are covered at 100%, especially with the county's insurance. I wish people would just come in more so I can just let them know it is covered. We'd love to see them. Might as well use what you pay for.
I did it already. She said I had great far-away vision, and then my close vision in one eye isn't that great. But she said they're it's like $10 for the vision thing. I don't know. Anyway.
Yes, we are here today promoting the new prescription discount drug card for county employees and all residents. This prescription discount card gives up to 25% discounts on prescription medications as well as pet meds. The program also has a low-fee health insurance program as well as dental to give discounts on both health and dental services. This is for all of the citizens in Polk County. Both the employees and non-employees can participate in the program. The prescription piece of this program is free for anyone who uses it, all family members. The dental and the health discount program, there is a low fee associated with participating in that piece. However, the prescription piece is free of charge. There are no eligibility requirements for this program. Anyone who has a prescription that needs to be filled can participate in this program and get the discounts. Prescriptions are increasingly becoming expensive, and this is an opportunity for you to get discounts on that. With all of the other rising costs of everything else in our lives, this is just a small piece to be able to discount some of those things.
So I work with Belltone Hearing Aids, and today we're just giving information on hearing aids and hearing loss, benefits of having hearing aids, and tomorrow we'll be doing hearing screenings at the other health fair. We're a national hearing aid agency, and we work with all different hearing aids. We deal with hearing loss and helping people hear better.
At the Center for Cancer Care and Research, we are a freestanding cancer center, an affiliate of the Moffitt Cancer Center in Tampa. We offer comprehensive cancer care as well as clinical trials. We are here today promoting health and well-being.
And I work for the mammography area at Watson Clinic, the Women's Center. We diagnose, we do screening mammograms, we do diagnostic mammograms, ultrasounds, biopsies of breasts. We find breast cancers, we rule out breast cancers, and then refer people, women or men, on to physicians, surgeons, or oncologists, either one. Baseline mammogram is generally done at 40 years of age unless there's a personal history, family history of either cervical or breast cancer, because they kind of pretty much go hand in hand. Men also can contract breast cancer. We do diagnostics on men as well as women. The area that I work, we are strictly diagnostic. We are screening and diagnostic.
The Better Bladder Center is a part of Bond Clinic. Dr. Carlos Gabriel is an OBGYN, but we also specialize in pelvic health. So we work with female patients who suffer from light bladder leakage, pelvic pain, overactive bladder, and other pelvic floor issues, and we have a non-surgical, non-medicinal pelvic floor rehab program. The most common symptom that we treat is incontinence, so light bladder leakage, leaking urine in small amounts or large amounts when you feel like you have to go to the restroom but can't get there, leaking when you laugh, sneeze, cough, bend down, exercise, and also that overactive bladder, that feeling of always having to go. There's lots of causes. Genetics, age can be a factor, childbirth can be a factor, trauma to the pelvic floor can be a factor, general health as well. Coming to the Bladder Center, it will fix your problem. This is one of those things that if you don't seek treatment, it will only get worse. So if you don't fix it, it's just going to get worse. It's not going to get better on its own. And it's something that we can treat easily. It's effective, and it's one of those things that there's no medication, there's no surgery. So even if it doesn't work for you, if for some reason it didn't work, there's no other implications, there's no side effects.
If you are a Polk County employee and would like more information about health and wellness services, visit the Benefits tab on the Polk Hub at polk-county.net. Next up, we are going to take an inside look at how the low-income pool grant affects the residents of Polk County. This grant has enabled over 20,000 county residents to receive integrated quality health care. Stay tuned. You're watching Picture of Health.
My take on the LIP grant is that essentially it's an essential piece of what we do at the Family Health Center. The LIP grant has helped our patients in a number of ways, primarily in the formulary that we're able to use to help our patients in order to be able to be taken care of. You know, if you have a doctor to come and see, but you have no ability to get the medications that you need to stay well, it kind of almost shoots yourself in the foot pretty significantly. And that's probably the greatest aspect that the LIP grants provided here at the Family Health Center on a day-to-day basis for our patients.
The goal of this project has been to get people care at the right place, at the right time, in the right setting, and ultimately keep them from going to the emergency room.
With the LIP program and working and collaborating with the other community resources, it actually gives us the opportunity to refer the clients out for it's like if I have a client that needs to see an endocrinologist or a cardiologist, I'm able to link up with We Care Polk County and actually get them on a list to be seen by a specialist. Or if they needing behavior health, I can basically refer them to Peace River, who is in connection with the LIP program as well.
I've been a nurse at Peace River for just about 12 years, and I heard that they were opening a wellness clinic made possible by the low-income pool grant.
I just had nowhere else to go. I mean, I couldn't, I had 3 cars. I've worked hard all my life. I have a house. I have money in the bank, not a lot of money, but I don't qualify for any help. You know, there's no other body going to help you. They say, you can go here, they won't charge you anything. And I go there and I get my physical and they say, just $1. And they'd send me a $150 bill saying I didn't qualify for their, even though I wasn't working, I had assets.
A lot of our patients have so many comorbidities. A lot of them they're not even aware of. They're not aware they have diabetes, or they're not aware that they're hypertensive. But just coming over here because they have flu, that gives us an opportunity to serve them, not only for the flu, but then bring them back for follow-up to treat the real issues that have been plaguing them probably for years.
As me having diabetes and high blood pressure and sleep apnea and all that, we came down, I had no health care at all until I seeked out and was told about the Polk Health Department.
Patients with mental illness are dying 25 years sooner than everyone else, and they're not dying from schizophrenia or depression. They're dying from diabetes. They're dying from untreated medical issues. They're dying from things that are avoidable, that a lot of people are getting treated every day at the primary care clinic. And those symptoms are getting overlooked because the patient is so distracted with his behavioral health symptoms that he's not thinking about his blood sugar.
Another amazing aspect of that for the integration is the health department's dental clinic. I cannot tell you the number of people that we have that come in these doors that have dental issues. And that has been a huge burden that we had that has been taken up by them, and they've done a wonderful job as far as taking care of folks with their dental needs.
There's a huge need in Polk County for more access for dental services. The data shows that there's approximately 1 dentist for every 3,500 residents. So we don't have as many providers to be able to provide that access. And if someone is low income and if they don't have insurance, they're going to go without those needs being met, or they're going to end up in the emergency room. And we don't want that to happen. So part of this grant in the last year, we really beefed up the dental service side of it.
The LIP grant has enabled people to get health care that haven't gotten health care in a long time. They're also getting integrated care. So they've got one record, they've got a psychiatrist or a therapist and a primary care provider and a medication list, and everyone has, all the care providers have access to all of it. and really benefits the patient because of that. There's not duplication of services. There's not lab work that's being done unnecessarily because it's already in the record. So that's a big plus. Care integration, and the patient's feeling better. They're not feeling like they're somebody's treating their head and someone else is treating their body. They're feeling well taken care of, and their whole self is taken care of. So they're feeling really good about that.
I was done going to the doctors, to tell you that. So I mean, I probably wouldn't be here. I mean, my blood pressure was that high. I'm not trying to be dramatic. It was I could feel my blood pressure as I'm walking, and it was just terrible. I was lost, that's for sure. And if I didn't come here, I really can't venture what I'd be. I don't think it'd be good. I mean, I don't know.
I can't imagine what so many patients would be doing without the LIP grant and without these clinics. Wellness clinic, we have probably 500 or 600 patients right now that come to us and rely on us for their care. I don't know where they'd be if we weren't here.
I kind of lost my identity when I lost my job. I've always been the breadwinner, always supplied for my family, and take that away, and it's a big difference.
I think that if there's one glowing example of the type of patient that we typically take care of here is the fact that all of us are 2 or 3 hits away from needing a clinic like this to take care of us. Life throws all kinds of curveballs, and a lot of the people that we take care of are people who work, that have jobs, that just cannot afford health care, and that is probably the largest percentage of people that we take care of.
I think when you speak with someone or you hear someone's story who has benefited from the services that have been provided as a result of this grant and this collaboration, that's when you truly see the success. I think when someone is able to get the medications they need to control a chronic condition, or if they have never been diagnosed and they've continued to go to the emergency room for care, and they're finally able to get the treatment, to get the medication, to control the condition, to me, that's success every day. And we have over 20,000 people almost on an annual basis that's been served through this program. And to me, it's improving their quality of life, and that is a success.
Pulmonary hypertension is a rare type of high blood pressure that affects arteries in the lungs and heart. There are fewer than 200,000 U.S. cases per year, and many people who have the disease are undiagnosed because the symptoms are similar to more common diseases, such as the flu. In this next video, we have Angela Mann, an advanced nurse practitioner from the Pulmonary Hypertension Center at Lakeland Regional Health, giving a monthly informational session about this disease and how to live with it.
Again, my name is Angela Mann. I'm a nurse practitioner. I work with Lakeland Regional Health Pulmonary. I work in the outpatient setting. Currently work with 6 pulmonary physicians, and we currently do have a pulmonary hypertension practice clinic that's been open for the last 4 years. And as a result, I've gotten involved with the pulmonary hypertension community and have really found this to be a disease that I found a passion for, and so I like teaching about it. So we're going to talk a little bit about what pulmonary arterial hypertension is. Pulmonary hypertension is not a common disease, and it's not easily diagnosed. It's not able to be diagnosed by a simple test, such as a blood pressure cuff on your arm. It's not easily diagnosed. We can give an estimate whether or not you have some elevated pressures in your lungs by an echocardiogram. But the definitive test to determine if you have pulmonary arterial hypertension is through the right heart catheterization. During the heart catheterization, they feed a long wire, about yay long, and they feed it through the heart, through the right atrium and the right ventricle. And at the end of this right heart catheter, the pulmonary artery catheter is actually a balloon about 8 millimeters. We actually inflate the balloon. On the other end of that is a transducer. And it's this transducer with the occluded artery right there that shoots us about numbers. If it detects pressure on the other side coming from the left side of the heart, then we determine that it's pulmonary venous hypertension. If the pressure that we detect beyond this balloon is low, then all of the pulmonary pressures that we saw that were elevated before we put this in are determined to be of arterial And that's the definition of pulmonary arterial hypertension. So in a normal healthy vascular bed, you have a normal smooth muscle lining within it, and it has the capacity to expand and contract as your body needs it. So if your body needs more oxygen, it's able to expand and contract along with your respiration. As the vascular bed develops pulmonary arterial hypertension, and we'll talk a little bit more of the whys in just a moment, it starts growing extra tissue in the lining and on the outside of it, as you can see here. It forms what are called plexiform lesions, and these plexiform lesions develop on both the inside of the wall of the blood vessel as well as the outside wall of the vessel. So if you think of a garden hose, and you think of a large, say a regular garden hose and a fire hose, which hose is going to have more ability to get water through? It's going to be the fire hose because it's larger. As you decrease the lumen size of your blood vessel with these plexiform lesions, it creates more of a backflow pressure trying to push that regular amount of blood through, and that's where the pressure comes from. This would be an undiseased vessel that's nice and open, has complete compressibility and ability to respond to any of the body's demands. As it starts getting a little bit more diseased, the wall is a little bit thicker, it's a little bit more irregular. A more moderate disease, you can definitely see that the size of the lumen keeps continuing to getting smaller to the point of severe disease, where you now have these lesions both internally and externally to the blood vessel. And at this point, this is somewhat irreversible. There are theories now that with these longer treatments and the more of our medications that are available, some of this process can maybe reverse a little bit. The only way to determine if it's reversed is on autopsy, so it's not a commonly biopsied area, obviously. We are more likely to see shortness of breath, swelling in the ankles, dizziness, feeling of fatigue with every other disease out there. That sounds like the flu. That sounds like COPD. It sounds like congestive heart failure. It sounds like heart ischemia of the heart. So, and those are the things that happen more commonly. Those are the most common causes of death in the world, are heart disease and COPD. So it does take a while oftentimes to get a diagnosis of pulmonary arterial hypertension because, again, common things happen commonly. That's what we actively look for. There are many diseases that are associated with pulmonary arterial hypertension, the foremost being autoimmune diseases, particularly scleroderma, which is a mixed connective tissue disease, rheumatoid arthritis, not sarcoidosis, scleroderma, rheumatoid lupus, that's the other one. It is also heritable. They have detected a particular gene, and there has been some familial trends in pulmonary hypertension. The sleep apnea, untreated sleep apnea, has been a contributor to pulmonary hypertension in that chronic low oxygen states can contribute to pulmonary arterial hypertension. The chronic pulmonary embolism, some people get a blood clot in their lungs and it just doesn't go away and it turns into a globby, sticky mess, and that can cause pulmonary hypertension as well. Typically, somebody that has a class 1 functional class has very minimal to no symptoms. I'm probably not going to be seeing them because they typically are not short of breath at this time. It may be a coincidental finding to find somebody. Maybe they've had some other form of surgery or some other form of interaction in the hospital, ended up with some kind of a pulmonary artery catheterization, and surprise, we found this. That would be probably the least likely to show up in my office. Functional class 2 is where you're starting to have impairment. You're having shortness of breath. It is starting to impair some of your day-to-day activities. You may be starting to have some low oxygen levels. Functional class 3 is where it's heavily impairing your day-to-day activities. You are probably at this point wearing oxygen at all times. You're short of breath more than you're not short of breath. You're tired. You're fatigued. You just don't have any get up and go. Functional class 4 is where you're pretty much completely debilitated and any activity wears you out. Any activity drops your oxygen levels. And so our medications then, where we start them and what we start them which ones we start with are based on where your functional class lay. What are the things that you can do as a patient, as a family member, as a support person? So one of the things that is very important is fluid restriction. And I'm not saying cut out all fluids altogether. I'm saying be aware of the fluids that you're consuming. And some people are more sensitive to the fluids than others. Diuretics are very important in the medication management. So if we're giving you a diuretic that's making you urinate and get out your extra fluid, that doesn't mean drink and drink and drink and drink and drink. I can't tell you how many patients in heart failure come in my office carrying a big old mug of something. So the fluid management is a very important topic. So as we're pulling it out, I don't want you draining it back in. Keep a list of your medications, their doses. You want to have a list of your pH providers, their contact numbers, your specialty pharmacy. The specialty pharmacy is able to pull out all of the medications and help get in contact with stuff, or get in contact with their providers and contact the pharmacy staff there at the hospital so your doses can get done appropriately. There are times during hospitalization when they may have, say, in the endothelin receptor antagonist medications, there's 3 of them available, and the hospital may only have 1 on pharmacy, on formulary. They may transition you to the other one. Sometimes that goes flawless and sometimes it does not. Some people do well with it and some people do not. So again, I would encourage you to get the order, whether it's you ask the attending physician, may I use my own meds, or have your pH coordinator help and facilitate that. Have that information on you at all times. Have your loved one have that information on you at all times. Another one that's important is the daily weights. This one goes back to that fluid restriction. A daily weight is free, and it is one of the most sensitive indicators for you to be able to judge your volume. How much fluid are you retaining on a day-to-day basis? If you have a 2-pound weight gain in one day or a 5-pound weight gain in 1 week, that's fluid. Then that means you're overdoing it, and we might have to pull some extra out. And you may notice more swelling in your ankles, things like that. So the end result of pulmonary hypertension is that as the disease progresses and you have this continuous backup flow of fluid, your heart's having to work harder, we're always watching for signs of right heart failure. Right heart failure can manifest in things like the shortness of breath. It can cause the veins in your neck to get distended. You can see larger volumes of fluid. Some people end up with some cirrhosis or an abdominal swelling because the fluid collects in the bellies. That's where you get the large swelling in your ankles. So these are all the questions that I ask when I'm assessing somebody as well. But if you start noticing that you're just getting more abdominal swelling or more short of breath, one of the first things I look at is your fluid. And then we start, once we know that we're at the driest point that we can and still having more progressive shortness of breath and heart failure symptoms, then it's time to start changing therapy.
That's all the time we have for today. You can catch this episode of Picture of Health on Mondays, Wednesdays, and Fridays at 10 a.m. or 4 p.m. on PGTV, or catch all previous episodes on our YouTube page. I'm your host, Tina Mann. Thank you for joining me on this month's Picture of Health.